I am Dr. Sarkhel, consultant psychiatrist from Living Mind. We are primarily based in London. We have also got clinics in Essex and Birmingham. We are proud to announce that we have launched a new drug-free treatment for depression, fairly a non-invasive approach, hardly has any side effects, particularly if we compare to the alternative modes of treatment, for example antidepressant. It is popularly known as rTMS, which stands for repetitive transcranial magnetic stimulation. Essentially, it involves giving repetitive magnetic pulses focusing on a particular part of the brain that's responsible for various conditions, for example depression. rTMS is particularly popular because, apart from the beneficial effects, lack of any side effects, particularly in comparison to antidepressant. Essentially what it means, patients come to the clinic, a magnetic coil is placed on a particular part of their scalp, and the treatment approximately runs for 32 to 34 minutes per session, 5 days a week for anything between 3 to 6 weeks. That is a standard protocol for treatment of depression. This is now also approved by NICE in UK, particularly for patients who have not responded to 2 or more antidepressants. If we think about antidepressants, weight gain, sexual dysfunction, loss of appetite, sleep disturbances are fairly common side effects, and often that is responsible for non-compliance with the medications. Patients do not like to take it on a regular basis. It can be a stigma, taking it in front of someone or at work, whereas rTMS does not have any of those side effects, and therefore compliance is not an issue. So far we talked about rTMS in treating depression, but it's a good news that there's plenty of evidence base to suggest rTMS can be effective for anxiety disorders, obsessive compulsive disorders, eating disorders, post-traumatic stress disorders, and addiction disorders. If we now go away from the mental health side, regarding the physical health conditions, NICE has now approved for treating migraine. It is also an effective treatment for pain management. Now, it may sound like it treats almost everything, but what it really means that for all these different conditions, different parts of the brain is involved, and therefore rTMS is targeted at different parts of the brain using different protocols. The duration is different, duration of each session is different, and the duration of whole treatment can be different. But it's a non-invasive, almost side effect free intervention. At present, as we speak, there are not many NHS trusts that delivers rTMS, maybe 3, 4 or 5 in the whole country, because it is expensive and therefore it is more readily available in the private sector, and we are privileged to be one of them. But perhaps where we are different is during the session of rTMS, I tend to spend time with the patient, talk about lifestyle, diet or nutrition, several psychological strategies, and I'm very much interested in mindfulness. Evidence base has now suggested that if we can get our brain engaged in meaningful activities, success of rTMS is much more superior, and therefore we have been combining mindfulness with rTMS during these sessions, and that has shown that patient has engaged more and it has facilitated their overall recovery. It is possible that after rTMS, patients may be able to come off antidepressant, and maybe in the future, in a year or two, if they have relapse, they can have another course of rTMS. So therefore, it is not just rTMS, but is combination of other complementary therapies, other drug-free approaches that we offer in our clinic on a regular basis. We also give patients choice. They can have regular treatments of reflexology, mindfulness, or even acupuncture after their rTMS treatment. And sometimes, even during the rTMS, I often combine with mindfulness, and we are increasingly seeing great results. Of course, as we said, it's not available in all the clinics in UK at present. There are only few clinics, particularly in the private sector. And yes, it is not a cheap treatment. It is perhaps more on the expensive side. But I suppose if we think about the long-term benefits, absence of side effect, I do not consider overall it is that expensive. So yes, how much does it cost? We have kept the cost fairly minimum, considering our clinic is right in the heart of Mayfair, London. Each session costs £200 and therefore £1,000 per week for 5 sessions a week. And usually it takes anything between 4 to 6 weeks. Sometimes patients might need maintenance treatment, for example, fortnightly or once a month. If a patient comes without a diagnosis of depression or other psychiatric conditions, then we may need to assess them separately, and of course that will incur extra fees.